Welcome, everyone, and thanks so much for joining us on the Flourishing Life podcast, where we will be discussing what we see on the daily. We're Jackie and Tad from Flourish Medical and Wellness in Savage, Minnesota, where listening to our patients is the priority. Our foundational medicine clinic bridges the gap between traditional and functional medicine. We are pattern recognition specialists that focus on individualized patient care and health optimization. With a combined 30 years of medical experience, our goal is to provide insights that help you take control of your health. Be sure to follow us on Instagram at Flourish Medical Wellness and on our website, flourishmedicalwellness.com, to stay up to date with what's happening at the clinic. The following content is the opinion of Jackie and Tad Tavis and is not intended to diagnose or treat any medical conditions. Be sure to speak to your healthcare provider for your unique health needs. All right, you guys, we are here with Morgan. She is a PA on our team, and so we're excited for you guys to get to know her as well.
This is going to be awesome. So Morgan, we know that you're excited to be here, a little bit nervous. I'm nervous, so that's okay. We can be nervous together, but let people get to know you a little bit. So tell us about your family, what you like doing outside of work here.
Yeah, so I just had a baby, so I have a 5-month-old, so I've been spending a lot of time with her. I have 2 dogs and a husband, so she's an angel. Yeah. So I'm having a lot of fun.
That's
awesome. Great.
Yeah. That is awesome. Well, since being here at Flourish, what are your favorite areas of practice, or what are those things that you really enjoy doing?
I've really been enjoying perimenopause kind of stage and helping people with that. Mm-hmm. And then I'm really liking kind of getting into gut health, and I really want to learn more there. So I've been loving kind of focusing on that for people, specifically I have a few people I'm seeing for acne that I'm excited to see kind of like what improvements we can make just with like focusing on their gut. Yeah. So I'm really liking that.
I love that you love the gut
and
that you are interested in that, because there's not a lot of us here who really enjoy the gut.
Yeah.
And it's so complex.
I want to learn more
and
kind of dig in.
One of the nice things too is that with all the information that's now out to everyone on podcasts and different avenues for information, people are understanding how important the gut is to overall health, how much inflammation stems from the gut, skin issues, like you said. I mean, you want to look at a teenager who has really rough skin, start digging back into their eating habits and their gut and sugar and dairy and all those things too.
Even like moods,
Absolutely.
Yeah.
All right. What brought you here to Flourish? What got you interested in this kind of medicine?
So I think I've always been kind of interested because of my own health issues, which is pretty common for people that get into this.
Yeah.
And so even like prior to PA school, I was kind of starting to learn a lot. And then I went to an integrative program, hoping to kind of learn a little extra than just conventional medicine. And then I just kind of kept learning through podcasts and reading and trying to fix my own health issues. And then I started in emergency medicine and kind of moved into urgent care. So being in more reactive medicine, it didn't fit. It just didn't feel right. I knew there was more.
And that we needed. Something was missing.
Yeah. And I knew like we need to work on root cause. We're not really helping people if we're just giving them consistent medications over and over, and then I'm seeing them in the ER with like all these chronic conditions. Kind of felt like we weren't getting anywhere. So
yeah, I think a lot, like you said, a lot of people who do this kind of medicine have a story.
Yeah.
Like either personally or a family member or something where kind of that traditional medicine like failed them to a degree or just didn't help. So I think that's a pretty common thing that I hear.
Yeah. Well, and then understanding that this kind of medicine is not just about knowing the ins and outs. It's not about knowing the information. You have to be essentially half health coach. You have to know how to empower people to make changes, to communicate exceedingly well, especially when plan A maybe doesn't work as well as you and the patient want it to.
Yeah.
So there's a lot to it there.
Listening. I feel like we're a lot of times like investigators.
Yes. And that's what I like.
Yeah. Like we have to investigate, really listen, figure out the details, put the pieces together, and then like create this plan that's never the same for the next person because everyone's different.
Yeah.
So,
and then trying to kind of meet people where they're at too, because sometimes I get overly excited. And some people, that's like too much for them. So trying to like dial it back and meet them where they're at with like baby steps.
Yeah.
Totally.
But some people want to do it all. So that's also exciting.
Yeah.
So.
Absolutely.
For sure.
What feeds you most here? Or, when you think about your clinical practice and you're talking about a topic or you're seeing a certain type of patient, what really lights you up?
I think it always comes down to food as medicine. I think that's like it's so cool to actually see improvements when people just change their diet. I think that's amazing. And so when people maybe eliminate a certain food, or even we just add in nutrients and they come back and they're like, I feel way better. That's awesome.
Yeah.
Because that's like such a simple step.
Yes.
And then you can build from there. But I think it all comes down to what you put in your body.
Okay, so all of us here know that sometimes that's a harder request, right? It sounds like, come on, like just change your diet, right?
Yeah.
And we'll give instructions on that, but just being like really straightforward. Why do you think that is? And what, like, is there one thing that you found to kind of really get that switch to flip for patients to be like, oh, it is worth it?
I think specifically when you are looking at thyroid antibodies and then you have them just simply go gluten-free, which I guess when I say simply, it's simple to me, but maybe not to them. But if they do it and then you actually see improvements, I mean, there's like actual data for them to see. So I think that's a switch for them.
Yeah.
Or their gut feels way better and they're like having regular bowel movements and they haven't had that in forever. And I'm like, yeah.
And then they realize how amazing it feels to poop regularly.
Yeah.
Well, and also how disruptive it can be or has been for certain people. Talking to people where they're saying, hey, no matter where I go, what I do, I have to know where the nearest gas station is. Or I have to make sure that we plan out our stops this way on the trip because my bowel movements are so unpredictable. Like, it's a big deal.
Yeah. So when you fix that just by taking something out of your diet, like that's super cool.
Absolutely.
And simple.
Yep.
What are some myths or misconceptions that have come to you over and over again in clinical practice?
I guess I think of the weight loss patients and people trying to eat like way less calories. They're at like 1,000 or 1,200 calories. And I'm like, this is your basal metabolic rate. Like, we can't be doing that. And then they're just doing cardio. So that kind of kills me.
Yeah. Yeah.
Gotcha.
Cardio is not really going to get you where you want to be in terms of like body composition. So I like when I can get people to start weight training.
Yeah. I feel like it was so many years that's the message we heard, like calorie deficit and cardio.
Yeah.
Like,
and it's
for years.
Not it.
Yeah.
Yeah. And it's interesting because it's not completely wrong, right? I mean, working on your cardiorespiratory fitness is huge. And we look at things like VO2 max as a predictor for longevity. So there's definitely some evidence to back that up. But at the same time, got to have muscle. It's the currency of aging.
Yeah, you can't only be doing like long distance running and seeing.
It is also hard to get those long distance runners to change.
Yeah.
I've found it's just, and I think part of it's like this emotional connection that they have with it as well. But yeah, that can be a hurdle for some people.
Yeah.
Absolutely. So how does your practice here differ from what you were doing previously in medicine?
Well, like I said, working in the ER, it's very reactive. So I was really just treating people for their emergent concerns that day, versus now I'm actually trying to help people with maybe their chronic illnesses or prevent that from like actually changing their lifestyle and diet and lifting weights and all those things so that we don't end up with chronic illness in the ER down the line.
So tell us a little bit about your practice style so that people can kind of understand if they come to see you what to expect and what you think is important in how to treat people.
Sure. So I think I always kind of start with the foundations of food, our diet, and then the basic nutrient deficiencies. But I do lay out a big plan for people, and that might be different from other practitioners, but I do go pretty in depth. And I lay out a plan, and maybe we don't do it all right away, but I like to have people see like what the options are as tools, and maybe we add that on later. I kind of figure out where that patient's at. Like if this is overwhelming, we're going to just start with baby steps. But some people are like really excited, so we're going to start with multiple things.
Cool. Yeah.
Love it. That layering approach is pretty cool. Saying,
Yeah.
okay, we can start here, and then these are things we can consider in the future too.
Well, and I think it's so important to set expectations, because I think a lot of times in traditional medicine, it's a lot of patients are trained to think they're going to come in and then here's your medication or here's your answer that's going to fix all the things. That is not reality.
And it's going to take some time.
Yeah.
You have to put some work in too. So
And
I am trying to.
it's never just one thing. The body
Right.
is
There's
so much
many
more
options of things we can do. And they're all going to take time.
Yep. For sure.
Absolutely. To piggyback on that, what is one really important lesson that you've learned in clinical practice over the past year?
Probably that not everyone is as excited and motivated about functional medicine, foundational medicine, as maybe I am. So I do have to meet them where they're at and pull it back a little bit, because I do get excited, specifically with like dietary changes.
Yeah.
So
Yeah.
I'm
Okay.
dialing it down.
Side note, what is your favorite? Do you have like a go-to morning routine that like you gotta do? It sets your day up for success.
I should, but I have a baby.
Did you before baby?
I used to yes. So there's things I could probably get back onto. I used to always have like a warm glass of water with a lemon to help my digestion. I do always try to eat breakfast with high protein before I have my coffee and spike my blood sugar if I put some creamer in there, which I now do.
Yeah.
I try not to go on my phone right away in the morning.
Yeah.
Cool. You'll figure it out. It might not be for a while until she's much older, but
Yeah.
You'll
my
get back
mornings
to the
are
routine.
looking a little different than they used to, but
yeah,
for a good reason.
totally.
All right. So coming from emergency medicine, a little different pace here at Flourish. What is your favorite part of practice here at Flourish?
I love to actually get to talk about things I'm passionate about with patients, and then they actually come back and feel better, and it's awesome.
Love it.
In emergency medicine, I never really saw patients back generally, so I didn't actually get to see how they were doing. Here, I actually get to follow up on people and see that they're feeling better, which is awesome.
And having more of that relationship, like establishing that relationship is super fun.
Yeah.
And rewarding.
I think that's part of the secret sauce is providers being able to be talking with people about topics that they're really passionate about. I mean, we look at those things, we learn about those things from multiple different sources, but then being able to see how that area that we care so much about improves somebody else's life, it's awesome.
Yeah.
All right. One really important health habit for everyone. Go.
It's going to be eat real food for sure.
I knew it was going to be that.
It
for you.
has to, I feel like you have to start there.
Yeah.
You have to actually have real food and not processed crap.
Yeah. And what's real food? I think there's such a huge gap here in real food. Like when you're talking to someone like, oh yeah, I eat pretty well, you always have to ask, what does that mean? What are you actually eating? Give me your last 24 hours of food.
Right.
And then it's, some crackers and cheese and some pretzels and hummus. And yeah, that's not real food.
Yeah, like real meat and actual vegetable, colorful vegetables.
Yeah.
Yeah.
Eggs.
Real whole foods.
Yeah, just like
things from the earth.
yes.
I just want to live off Oreos and Diet Coke. Let's do this.
Yeah. No.
Yeah.
You'll feel like crap.
Yes.
You'll get none.
Okay, I have a question. Do you have a favorite transformative story or just a patient that stands out? Or maybe it was even like your first one of like, wow, this was so cool that we did this.
I even recently had a patient who she started elimination, and then we just gave her some nutrients. And she did the elimination for a little bit, and then she got sick, so she's going to restart. But even getting her nutrients up, she was like, my energy is way better. I feel better. I was like, That's awesome. And we did pretty minimal amounts, so we have like room to go. But I thought that was cool. I think right when I started here, I was really amazed by replacing testosterone and people coming back and being like, I feel like $1 million and I feel amazing. And I was like, this is cool.
That's cool. Yeah.
For sure. Well, and looking at that interplay too between gut health and hormones, I mean, there's so much there, especially with just quality of life too.
Yeah.
All right. So if you had one big piece of advice that we haven't talked about yet to give all of our listeners, one big piece of advice for health now and longevity into the future.
So besides real food, I would say start lifting weights and gaining muscle and strength. Yeah. I think that's like huge for longevity and for your just basic metabolism.
Absolutely.
We good?
And that's a wrap.
Thanks for listening to the Flourishing Life podcast. You can watch the full video version of this podcast inside the Spotify app or on our YouTube channel. If you liked this episode, please rate, review, and subscribe on your favorite podcast app. And we would love it if you would share this episode with a friend and follow us on socials, Instagram, TikTok, YouTube, and Facebook, or on our website at flourishmedicalwellness.com. Chat soon, everyone. The information on this podcast is for educational purposes only and is not intended to replace medical advice or to be a substitute for professional medical diagnosis or treatment.